I'm Dr. Phillip Vernon. I have a diploma in medical acupuncture. I have a diploma in Chinese herbal medicine, and I practice half of my time as a NHS GP, and the other half of my time I do Chinese medicine and acupuncture at Acumedic. The basic difference between Chinese medicine and Western medicine is that Western medicine aims at a differential diagnosis. Not this, not this, not this, that. Chinese medicine takes all the symptoms to paint a picture to give a syndrome diagnosis. So that in Western medicine you might have a diagnosis of anxiety. In Chinese medicine, it might tie in with a heart yin deficiency, a liver qi stagnation, etc., etc. So you can have different syndrome differentiations for the same Western differential diagnosis. And this is one of the great benefits. Often patients will complain when they've been to Western medicine that they're given a diagnosis and treatment, but a lot of the peripheral symptoms aren't addressed. Whereas when they come to Chinese medicine, all the symptoms can alter the syndrome differentiation, which can alter the acupuncture points used and alter the herbs given. Any doctor, Chinese, English, wherever, should start with the history. 90% of the diagnosis is the history. So you might have a good system of medicine and a bad doctor, but there's no difference. A good Western doctor, a good Chinese doctor will ask a lot of questions. In Chinese theory, there's a structured way of asking questions about certain things, but a good doctor will ask many questions anyway. But one good example is hot or cold. Is the patient generally hot or cold? A Western doctor might ask that in terms of an acute fever, but in terms of more chronic illness, they wouldn't tend to put any emphasis on heat or cold. Excess or deficiency is another question in Chinese medicine. Too much, too little, in terms of energy or many things. Western medicine doesn't tend to do that. The other important thing is that Chinese medicine uses the tongue and the pulse. Now, I always say, it's still the history that's most important. Typically, they'll have mentioned their symptoms to their doctor, but their doctor may not have asked them the Chinese diagnostic model. So we then go through the hot, cold, deficient, excess, sweating, no sweating, and the whole process. Then we get an idea from the questioning where it might be in the area of the liver, the heart, the spleen, the Chinese organ systems. We'll look at the tongue. In gross terms, it's a big tongue, a small tongue, a pale tongue, a bright red tongue. We'll feel the pulse. And we'll add it all up and we'll look and see if we can get a syndrome differentiation in terms of Chinese medicine. So it might be liver qi stagnation, heart yin deficient, kidney yang deficiency. And all these mean something. So I can write that down, and any other doctor in this clinic, and hopefully in any Chinese clinic, will know exactly what I'm talking about. So they can go to another Chinese doctor with a diagnosis of, say, kidney yang deficiency, and another Chinese doctor can say yay or nay and see what herbs we're prescribed. In terms of something like impotence, often nothing is found in the Western diagnostics. Having said that, diabetics, spinal cord injuries, they will cause it. But a lot of impotence, there's nothing to find. They come here, and we might find kidney yang deficiency, and we will give them herbs aimed at that, and it may help them a lot. Most women who have period-related problems will often be investigated, blood tests, maybe a scan, not much found. They might have irregular painful periods and they'll be told to go on the pill to see if it works, which can work in some cases. But Chinese medicine seems to help a lot with period-related problems. It's always a good idea to have a Western diagnosis first. You might have severe endometriosis or severe polycystic ovary, but the treatments tend to be limited, hormonal based, which carry risks. So I would recommend women with period-related problems to try Chinese medicine. It can be dramatically effective. Stress, of course, yes. Anxiety and depression. Having said that, some times I get a patient coming through the door and I fear for their safety, suicidal intent. Make them go to their GP, tell them to register their problem and come back, but you can't take responsibility for the severely psychotic patient who's a danger. But the average patient who's overstressed, making themselves anxious and depression, I wouldn't put them on antidepressants first. And only today, more information about young people having an increased suicide risk with antidepressants. Try some acupuncture and Chinese medicine.